Enrolling in Medicare can be difficult. You have to be conscious of certain dates and times when going on Medicare. I have a client of mine who is 87 years old. He's had Part A since the time he was 65, but he's been on an employer health plan all this time, 22 years. Now he wants to completely retire and go completely on Medicare. And so there's a couple of forms you have to fill out, asking for your Part B and having your employer sign off saying that you've had health coverage from the time you were 65 until, in this case, 87, 22 years. And so as we're getting things together, he was able to cover most of that time, about 19 years. But there was 3 years in there where he wasn't able to find his employer because the company had gone out of business. And so he went to Social Security Medicare trying to get on his Medicare, but because he wasn't able to show that he had coverage for those 3 years, he's going to have a 30% permanent penalty added to his Medicare Part B premium, and they're delaying his enrollment in Medicare until July 1st. And right now it's January. Fortunately, he's able to get health coverage through his employer. He's still hanging on there. But because of those rules around enrollment in Medicare, things are really difficult. Now, we're fighting it and trying to get things resolved. But just to emphasize that it is important to know the rules and follow the rules when it comes to enrollment in Medicare. Now, the important date for going on Medicare is age 65. You're able to enroll in Medicare 3 months before the month of your 65th birthday, the month of your 65th birthday, and then 3 months after you turn 65. Though there's a whole set of rules around those 3 months after you turn 65. Now, you can delay enrolling in Medicare because you have an employer health plan, and you can delay indefinitely without penalty. Though again, remember, you're going to have to be able to prove that later on. And so what people generally do is just enroll in Medicare Part A. A is an apple, and A has to do with the hospital. A also doesn't cost you anything, and it'll be secondary to your employer health plan. The nice part about having Medicare Part A is that you're set up with Medicare and you have your Medicare number, and it should be a little easier later on when you decide to turn on Part B. So that's called your initial enrollment. Your initial enrollment is when you turn 65. And the 3 months before you turn 65, the month you turn 65, and 3 months after. Now, the next important date in terms of enrollment has to do with annual election. Used to be called open enrollment, but to distinguish that from other periods, it's called annual election now. An annual election is for people who are already on Medicare, and that time is October 15th to December 7th. That's when all the Part D plans will change, the Medicare Advantage plans will change, and that's your opportunity to make a change in your Part D or Medicare Advantage, switch from a supplement to Medicare Advantage, from a Medicare Advantage to a supplement if you like, and that's the period when you need to make those changes. Now, you probably see all kinds of advertisements on TV. You're getting all kinds of stuff, if you will, remind you in the mail, though it still amazes me how many people miss annual election. But again, if you want to sear that in your memory, it is October 15th to December 7th, annual election every year when you can make changes to your Medicare plans. The next important time is called Medicare Advantage open enrollment. And that's from January 1st to October 31st. Now, during that time, a couple of things can happen. You can change your Medicare Advantage plan if you're on a Medicare Advantage plan. What Medicare has found over the years is sometimes people will get on a Medicare Advantage plan and then find out that the doctor that they've been seeing is not in that plan, either because they didn't check or a mistake happened. And so it's sort of a get out of jail free card, one chance to change back to your Medicare Advantage plan or to another Medicare Advantage plan that works better for you, either because of the doctor network or medications, those types of things. So you can just change once, and that's from January 1st to October 31st. Also, during that period of time, you can get out of your Medicare Advantage plan. So get out of it and go back to what we call original Medicare. So to distinguish Medicare Advantage from the other Medicare, we call it original Medicare. Original Medicare is Part A and Part B exclusively. And so you can leave your Medicare Advantage plan and go back to original Medicare. And then you get a one chance to enroll in a Medicare Part D plan. And then usually people will get a Medicare supplement at that time. That's usually why they go back to original Medicare. Now remember, when you go to get your Medicare supplement or Medigap plan, there's no guarantees on that usually. And so you'll have to answer health questions, especially in Nebraska and Iowa, generally where I'm working, you'll have to answer any health questions. There's no what we call guaranteed issue during that time. Now, the next time that you want to remember, and this one is a little bit more obscure, is called general enrollment time. This is for people that miss their initial enrollment time, and it's people who, for whatever reason, are past 65 and they didn't have an employer plan and they can't enroll in Medicare because they don't have that dispensation there. And so what happens is you're able to enroll in Medicare for the general enrollment time from January 1st to October 31st. So you fill out the forms, you enroll then. But you cannot get your Medicare until July 1st. And so that's when it starts. And at that point, you have an open enrollment to get a Medicare supplement if you're just going on Medicare for the first time, Part B for the first time. And then you may also select a drug plan, a Part D drug plan at that time. You can't get a Medicare Advantage plan. You have to wait all the way till annual election, again, October 15th to December 7th, and enroll then if you want a Medicare Advantage plan, and then that plan won't start until January 1st. So those are very important dates for people that are on Medicare. Your initial enrollment period, annual election enrollment period, open enrollment, Medicare Advantage open enrollment period, and then the general enrollment period. There's also what we call special election periods that apply to people. And this has to do, again, mostly with Medicare Advantage and Medicare Part D plans. So, for example, let's say you move from Omaha, Nebraska to Phoenix, Arizona, and you're on a Medicare Advantage plan or a Medicare Part D plan. You would have a special election period there. So you'd be able to switch from one plan to the next because Medicare Advantage plans and Medicare Part D plans are set up in a local area. So it would be a special election that you would be able to make a different selection and enroll in a different plan. So Medicare has all these rules and penalties that go with the rules. It's important to be aware of them, or to have someone that you talk to on a regular basis that is aware of them. If you need help understanding Medicare, understanding the enrollment rules, you certainly can give us a call here at Omaha Insurance Solutions, 402-614-3389. Chris Grimmond.